the Vancouver group now can make devices that can be done in one single step. So instead of these very elaborate polymerization reactions, we can get a one-step, very scalable reaction that's very well patented. I learned that now. You need to be very well patented going in. That's the one step we didn't tell you about. Be very well patented going into some of this if you want to get it into the clinic, right? Because nobody pays for all that preclinical work. NIH says nobody pays for that work, the key clinical work, ready to get it for development. So you end up having to get companies interested to get the preclinical work done to finally get you into the clinic, right? Companies don't want to touch something that doesn't have the right patents around it, right? It's not going to be useful to them. So dendrimer work is beautiful, but it's patented by Dow and a few others, and University of Michigan. Very hard to bust through some of that usage. Not impossible, but much more of a minefield, right? Whereas other devices now that we're working with based on the work we've done here that we can modify fairly quickly are going to be fully patent protected and more useful. Again, it's not patent protection so you make a lot of money. It's patent protection so that a company will give you money to allow you to finish the studies to get it to clinical trial. Because NIH, DOD, nobody pays for those preclinical studies to get it to clinical trial. Frankly, NIH doesn't really pay for most clinical trials. It's industry that pays for most clinical trials. So one step when you think about your devices early is, can it work? Is it interesting? But if you actually want to get into clinic early on, you're going to have to start thinking about, is it patent protected along the way? All right. So we didn't do that with this because it was already protected up the wazoo by Michigan and others, but that makes it a little hard to use. The other polymers we're working with should be a lot more biologically provoke much less biological response. Even though these provoked almost nothing, they should provoke even less in theory, but are much more scalable and patent protected. So taking a